Hello, my name is Schweitzer. I'm an anesthesiologist in Regina. My project was entitled Optimizing Post-Operative Monitoring of Surgical Patients with Obstructive Sleep Apnea in Regina. So a bit of background. OSA is a common disorder characterized by upper airway obstruction during sleep. Surgery, anesthesia, and opioid pain medications can all aggravate sleep apnea and increase the risk of post-operative respiratory failure. And it is recommended that patients at highest risk receive continuous oximetry after surgery. The way my project started is I collected data, and what I found was that only 10% of patients qualifying for continuous oximetry receive the recommended monitoring. And a 6-month retrospective review also revealed 5 severe adverse events, including 1 death in this patient population, just at 1 hospital in Regina. So this data was presented to our Department of Anesthesia and to the surgical executive. There was a decision to purchase new monitors that would enable continuous remote oximetry through Wi-Fi. The plan is to implement a trial on 5F at Regina General Hospital and then implement that as well on 4D at the Pasqua. We created a multidisciplinary team that designed a new monitoring algorithm and pre-printed order set. And this process was set to go in June, but because of some delays with clinical engineering, we're now set to be implemented in September of 2019. So our next steps with this project are presentations and education sessions for physicians and nurses regarding the new monitoring process, and then data collection to establish how it works. So the percentage of patients who will receive appropriate monitoring, frequency of alarms and nurse workload, and frequency of adverse events, respiratory therapy, and physician interventions. So my personal reflections after undergoing the CQIP program is that data is really key. So before I started this project, I would have conversations with colleagues, and sometimes I would get the response, yeah, maybe that's what it says in the literature, but that's never happened to any of my patients, and I've never heard of that happening in Regina. And so once I had concrete data, and in particular, real patient stories, I found that that was really powerful in convincing people that, that this was a real issue to care about and in mobilizing resources. As many others have reflected, meaningful change takes time and really requires a team approach. But I am very thankful to having had the opportunity to take the CQIP program that helped me navigate through the complexities of doing a CQIP project and the complexities of working within our healthcare system. I was very pleased to see that change is possible. And I'm very excited to see the final implementation of our trial, because I do think it has great potential to improve post-operative safety for these high-risk patients. And on a more personal note, what I've really taken with me into my life is to stay curious, be more open to hearing other people's ideas, even when they might disagree with mine. And I found that's been tremendously helpful both at work and in my personal life. And finally, these are just some quotes from our reading materials that really resonated with me about just culture. And I really like these statements that you need to understand your system and the factors that allow for mistakes to happen rather than relying on providers to be superheroes, and that people in healthcare can only work as well as the system that has been designed for them, and everyone is always doing their best. Thank you.